have a prop here, doctor. Can you show us what that is and what that means?
So basically what we call the C's stands for cervical, okay? So we have 7 cervical vertebrae, we have 12 thoracic, 5 lumbar, and then we have the sacrum and coccyx. So basically we start counting from the base of the spine, which is in here. That's what we call the occiput. So basically the first bone that comes out from is basically the C1. So after the C1, then we have the C2, the cervical 2, cervical 3, and so forth. So basically when we talk about C1, C2, and sometimes you might be hearing that on the reports, on imaging, you might be hearing C1, C2, C5, C6. So what we're describing is the space, the landmark between the first and second vertebra, second and third, fourth and fifth, etc. So basically between the C1 and C2, we're talking about this level here. So normally there's a joint, which is this one here. And that joint actually can get displaced, when people have rheumatoid arthritis. And our main concern is that we have the spinal cord that is running behind it, so it can compress. As you can see, there's a bone that slips forward.
Right, it gets reduced, right?
Reduce the space, and you compress the spinal cord at the C1, C2 level. So basically, all the nerve from C2 down, they can potentially get shut down, so you can be completely paralyzed from there.
And that obviously can be very dangerous. I was going to ask you that.
Correct.
You just
Absolutely.
answered that because it gets too narrow.
Absolutely. And we have an artery there as well, which is called vertebral artery, that is actually running. When I do the C1, C2 injections for people that they do have pain, we have to be very careful that we have this red structure that is running there, and that's actually going to supply, it's coming from the heart, and it's going to supply the brain, and people can develop a stroke.